All right, let's now move to another issue that actually does deal with children as well. The South African Human Rights Commission says patients' rights are being violated at the Rahima Moosa Mother and Child Hospital. The Commission visited there today following the public outcry over the suspension of a doctor who exposed the state of the hospital. Dr. Tim de Meye's suspension, of course, was later lifted only after an outcry from within the medical fraternity and the public. Our reporter Heidi Giokos was at the hospital today. She joins us now. Hello, Heidi. So this issue really has become a massive one. It started with Tim de Meye's letter, which was just absolutely horrifying, where he said that what hospital management is doing is contributing to the death of children because they simply aren't looking after the kids correctly. Today, Human Rights Commission there, what did they find?
Sally, I must say it was a shocking visit by the Human Rights Commission because, firstly, the CEO did not allow for media to be part of that engagement. We also were not able to engage with the CEO at all. We were directed to Gauteng Health. But the Human Rights Commission is not happy with the outcome of that interview. And while there is going to be a final report that will be submitted to the Human Rights Commission, Commissioner Boang Jones indicating to the media afterwards that the CEO was very dismissive. She did not answer any questions. She would not even explain who gave the authority to suspend Dr. Tim de Meyer, and nobody understands who gave that instruction, why that instruction was given. What's even more alarming is the fact that the CEO was not in the meeting that was held with Gauteng Health and the MEC on Friday that ultimately resulted in the suspension being lifted. This, of course, is painting a very concerning picture because, Sally, we walked around in the hospital today. We were only allowed on one floor, the ICU section of Rahima Moosa, and it's so sad to see that these doctors have to subject themselves to an environment where the building is basically falling apart. Not only that, there is no water because there's massive water problems in the area.
Weren't there manholes, not manholes, boreholes?
Yes, there were boreholes, but that only lasts up to a certain point. The doctors told us that children are dying because of the state of that hospital. It's not only the letter that was released by Dr. Tim, but doctors today told the Human Rights Commission that children are dying because of the state of that hospital. Doctors said that they use hand sanitizer when there's no water because they have nothing else to use. I want us to listen to what the Human Rights Commission said about that engagement with the CEO.
Meeting did not go as we had initially planned. It started off a bit late. We felt that the CEO of the hospital was not forthcoming with the information we wanted because this was a fact-finding mission for the Commission to understand the circumstances that led to the suspension of Dr. de Meyer. We do understand that the matter is now with head office. It's been handled by the DDG and the MEC. We have received a confirmation that the CEO was not part of the meeting, which led to the suspension being lifted last week Friday. Our overriding concern is the plight of patients who receive healthcare services at this hospital.
All right, so the real concern as well, apart from the doctors, is the patients. And Dr. Tim de Meyer was basically saying that patient rights are being violated, that children are dying because of the neglect at the hospital. Let's listen to what the Human Rights Commission had to say about that.
The right to health care is severely compromised. We do not think patients are receiving the kind of health care that they would receive at private hospitals. We have an unique opportunity as a country to use a hospital such as this as an example, as a flagship hospital on how to manage pediatric services. But the challenges seem to be insurmountable. There seems to be a culture of resistance to transparency and accountability. That's what we were able to pick up during our engagements. And that consensus. And we hope that through our intervention over time, we'll be able to firstly assist government in mainstreaming human rights and how they provide services to the public.
You know what's tragic, Heidi, is that this hospital, the Rahima Moosa Mother and Child Hospital in the Mayfair area of Johannesburg, used to be an incredible hospital, really excellent care for mums and babies. And then to hear Bang Jones saying that the right to healthcare is severely compromised and the culture of resistance is a problem. The CEO, has she commented on these very serious concerns?
Not to the media, and we, after the engagement with the Human Rights Commission, we asked if we can engage with the CEO, and we were told that all queries must be directed to Gauteng Health. Sally, I just want to highlight, and I think this is very important to emphasize, is the fact that doctors are in desperate need of help. And this is why you saw Dr. Tim coming out and releasing that statement, and he was willing to lose his job for this because he's saying that nobody else is listening. I want to put this into context quickly. Between 8,000 and 10,000 babies were delivered per year at Rahima Moosa Hospital. They are looking at over 16,000 babies per year now. The hospital does not have the capacity to handle this. They don't have the staff, they don't have the infrastructure, they don't have the resources, and they definitely don't have the budgets. So there are massive problems at this hospital, and the CEO needs to come out and explain what is going to be done. And if this is beyond the CEO and Gauteng Health needs to take over, that needs to be explained, because our most vulnerable in society are subjected to these conditions and their rights are being violated.
You make a very good point at that hospital in Coronationville, not Mayfair, of course. If it needs help, it's not going to be helped by someone who's resisting the change. So important that the Human Rights Commission went there. Let us hope we see positive improvements there and at other hospitals in this province that are under severe pressure. Heidi Giokos, thank you very much. Really important story.